parents in here, including young women, young people, I see caregivers, I see donors. Your presence underscores the collaborative spirit that drives the global. As a quick reminder, for those, the Global Alliance was launched in 2022 in Montreal, Canada, with a bold commitment to renew political leadership, mobilize resources, and close the treatment gap so that every child can live free from AIDS, and every child has a chance to live free from HIV. In just 3 years, we've seen incredible progress. From the Dar es Salaam Declaration through actions, through national plans in 12 focus countries, primarily in
Can I take it off? Can I take the charger off? It's not like
because it was community, I had to wait. And stronger community involvement in governance and accountability. As we look ahead, we are navigating a changing landscape. Shrinking funding, evolving epidemics, competing priorities, demand innovation, and renewed partnerships. So this session comes at a pivotal moment. I like that it's on integration because at GNP Plus on World AIDS Day, we did launch a report on the people living with HIV minimum asks for integration. It gives insights from people living with HIV on what true integration means for us. It calls for integration that's not just about efficiency, but about equity, ensuring HIV services are people-centered and fully embedded in stronger health systems. It aligns perfectly with our message today. Integration must be powerful and value-driven, a joint community effort to rebuild primary healthcare for children with robust accountability at its core. Over the next 45 minutes, we'll reflect upon our collective achievements, tackle persistent challenges, and co-create a shared vision for the Alliance from 2026 to 2030. Please stay with me and be attentive. We'll have a very interactive conversation, and occasionally I may come to the audience with a question, so stay alert. I hope by the end we all live here with clear understanding of what the Alliance is, it as a unifying plan, bringing together all of us, that will also commit to steps, country-led plans, and a genuine community to accelerate evidence-based solutions. I promise you this is the last you're hearing me lecturing. I would love to invite on stage the panelists. I will start with Dr. Anjali Akshreka, the Deputy Executive Director from UNAIDS. I'm a Toastmasters. I like to ask people to clap until someone makes it to the stage. Next, we have, I think my speaker notes are not very well organized. Could I just have all the speakers on stage, Luan, and the others, just come on stage, please, so that we can just have all of you. Clap for them. Bahati, there you are. Okay, so we have Anjali, we have Dr. John Enokwebe, who's the Presidential Health Advisor from the Democratic Republic of Congo. Bahati Hauli, my sister from Tanzania, a very vibrant youth, we are teaching democracy. From the Global Alliance, Community Champion, thank you for joining us. Luan, the Executive Director of PATA. And then we have Anurita Baines. Oh, Shafiq is here on behalf of UNICEF. And new to us, I'm very excited to meet you, Dr. Kasiva Teresa, the new director of HIV, TB, and hepatitis at WHO. I think everyone has been wondering who is she? Here she is. Let's clap for her. Thank you so much. So, to start us off, Angelique will share some reflections.
Thank you so much, Florence, and it's really fantastic to be with you all today. I think I just want to relay a few brief messages as we open up this session. And you actually mentioned something, Florence, when you were describing your integration strategy that you just came out with, being purposeful and value-driven. That has been also what has united this group and this global alliance, is being purposeful and value-driven around children. We are at a moment in time, an inflection point, where we cannot take our eyes off the ball for serving children. We know the gaps continue to remain for children, and we know that we have to move urgently to close those gaps for children. And so I am very pleased on behalf of UNAIDS and the joint program to be a part of this incredible platform that is the Global Alliance to End AIDS in Children by 2030. It's an alliance of multiple partners, over 12 countries that are a part of this, country governments, communities, partners, including Global Fund, PEPFAR, WHO, UNICEF, EGPAF, many partners who are part of this global alliance, and that is what has been making the partnership so strong and the results so strong, to continue to prioritize children, children on the map, and continue to serve children. The Global Alliance has served both as a political platform and a country and community action platform, and that has been something that has been incredible. We have to continue the work of the Global Alliance to make sure that the political, country, and community intersection continues to be prioritized for children. And as I said, while we've seen great success in serving children, we still see many gaps. We still see thousands of children that continue to die from AIDS-related deaths. We still see new infections that continue to rise in children. We still see the treatment cascade where children are farthest off in terms of their adult counterparts. And with what we've seen with the disruptions that have occurred this year, the responsibility is on us, everyone in this room, the governments, the communities, the organizations and agencies that we are a part of, to ensure that we continue to prioritize children in the HIV response, serve them, close the gaps that still exist, and not just have rhetoric, but action at the country and community level. So we look forward to continuing to work together as a partnership, mobilizing political forces, country forces, community forces to drive action to serve children. So with that, I just want to thank you all for being here and looking forward to this discussion.
Thank you so much, Anjali. I will just get this other one so that we can go to Dr. Sean. So, Dr. Jean, I'm going to say my question in English just this today. Next time we meet, I will say it in French, I promise.
Okay. Merci beaucoup. Bon après-midi dans la salle. Moi, c'est le docteur Jean-Eno Kwebe. Je viens parler ici au nom de la présidence de la République. pour annoncer une initiative, quelque chose que nous avons mis en place pour renforcer les efforts qui sont en cours afin d'obtenir l'élimination du VIH chez les enfants. En effet, aujourd'hui, nous venons annoncer la mise en place de l'initiative présidentielle pour l'élimination du VIH à l'horizon 2030. Durant les 5 dernières années, nous avons eu des progrès, certes. Cependant, on note une injustice criante en ce qui concerne la lutte contre le VIH chez les enfants. Et les chiffres en disent mieux, puisqu'on peut dépister au pays que près de 50%, et de ceux qui sont dépistés, il n'y a que 44% qui ont été mis sous ARV. En plus de ce que je viens de dire, tout le monde sait que le moment actuel est marqué par la baisse du financement global, ce qui a poussé le chef de l'État de la République démocratique du Congo de réunir tous ces 26 gouverneurs pour lancer une initiative présidentielle qu'on va évaluer en 2030. Et un fonds initial de 18 millions a été mobilisé pour ce faire. Donc 40% proviendrait du gouvernement central et 60% répartis dans les 26 gouvernements. Le système de santé. Le dépistage, le traitement et le suivi des enfants à risque et ceux qui sont infectés, sans oublier le maire. C'est un investissement qui démontre encore au plus haut niveau l'engagement politique de la plus haute hiérarchie à l'avantage des enfants. Notre vision est claire, un système de santé plus fort, plus intégré, plus capable de protéger nos enfants et nos familles. Et la responsabilité se place à 2 niveaux, avec un dispositif de gouvernance efficace, redevable et capable de donner le résultat. Le premier niveau, on a mis en place un comité de pilotage multisectoriel qui est directement rattaché à la présidence et il y a une coordination provinciale où chaque gouverneur est responsabilisé pour suivre la mise en œuvre. Les communautés sont les principales bénéficiaires et impulsent cette initiative dès sa conception. En fait, les communautés sont réunies autour des organisations de société civile multisectorielles qui sont impliquées dans la lutte contre le VIH. Ce sont ces communautés qui vont communiquer les vrais besoins, qui vont suivre la mise en œuvre allant jusqu'à veiller sur la rupture de stock. L'impact que nous attendons, c'est de voir améliorer la prise en charge des enfants, notamment dans le dépistage, dans la mise sous traitement et dans les activités de PTM pour soigner les mères et les femmes allaitantes. Messieurs et dames, avec cet investissement, avec nos communautés et nos provinces, le Congo compte ne plus voir des enfants naître avec le VIH à l'horizon 2030. C'est ça l'ambition que nous avons au pays et cela commence dès aujourd'hui. Je vous remercie.
So over the past year, Bahati, Tanzania has made notable strides through community leadership with the Global Alliance. Could you share one concrete policy or practice change that you helped influence, especially where HIV services were integrated with broader healthcare for children or adolescents?
A very good afternoon to you all. As introduced prior by Florence, my name is Bahati Haule. I'm the Global Alliance Community Champion for Tanzania, where we work with communities to ensure that the voices and the needs of children and adolescents are taken into national plans and are integrated into strategies that are being done into our countries. So for me, this has been an honor and a privilege over the past 2 years, where I come from a country where we are falling short in the pediatric targets for the 395s. And as a woman living and working with HIV, this has been close in my heart on how we avoid new infections, new deaths among pediatrics, but also how do we support young people who are the present and future caregivers and parents to these children to capacitate them. So we work with a bottom-up approach, where our main role as community champion is to use our lived experience, to use our advocacy, but also our work to bridge the gap between communities and governments in our countries. So we have been working closely with the Global Alliance teams within our countries to integrate ourselves and ensure that the voices of the community are part and parcel of each conversation. So working with the implementing partners, being in those subcommittees and technical working groups in our countries to ensure that the priorities and needs that are barriers to access health services are considered and worked with in my country. So this has been, we have seen it being profitable in our country, where we have seen new frameworks and new guidelines which are supporting the well-being and welfare of children and adolescents in transition plans for accountability in my country. We have seen new community healthcare worker frameworks, where we are working with people in the community to find other people. We have been seeing social contracting framework that we are working closely with the government. But over the past 2 years, in support of the Global Alliance partners in my country, we have piloted but also implemented the family-centered approach with partners such as UNICEF and UNAIDS, which is by and for the people living with HIV, going and ensure that no children is left untested and unlinked to services in our country. And with this, we have been able to reach more than 200 children with holistic services, and we have been able to document and advocate for this intervention. As such, we were even able to integrate it into our country cycle 7 demand. So even the Global Fund was able to adopt it so as they can scale it up to other areas of my country. So this all can be read through our breakthrough report that has been circulated. It's a work that shows the great work that the Global Alliance and the champions that we have been doing in country. So if anyone gets a chance, please read the report. But it also shows that there's still more work that needs to be done in our countries in order to ensure that we cover the gaps that are still existing in order to prevent mortality and deaths among pediatrics. And particularly for my country, speaking this means as champion working into addressing barriers and challenges, issues of age of consent, issues of insufficient commodities, point of care commodities. We still have criminalization of key population in my country. Issues of stigma and discrimination are still a major challenge, but also impacts of gender-based violence that comes into new forms in communities that still not only increase new rates of HIV infections, but cause lack of access, uptake, and retention of not only children, adolescents, but people living with HIV who are the caregivers and parents of these children in order to support them. So we have done great work under the Global Alliance in the past 2 years, and we are envisioning more work coming ahead so that by the time we come to reflect and measure the impact, will have left no child behind and have saved all the lives that we can. Thank you, Florence.
Thank you so much. Thank you so much. Yes, eloquently said, and just to clarify, the Breakthrough Partnership is a partnership of a number of organizations that have brief healthcare, UNICEF, ECFA, AIDS Forums, and White Plus Global, where I believe you come from. Thank you very, very much. I'm moving now to you, Luan, and I want to sort of bunch two questions in one, and hopefully we can try and answer them in the time available. You are an implementing partner and work very closely with healthcare providers. So very much on the front line and within the health facilities that serve children. What have you learned about what true integration looks like, particularly at the point of care where children and adolescents experience health systems, and what do you think, looking ahead, we must bring into the plans 2026 to 2030?
Thanks, Florence. Yeah, just thinking a little bit about integration and where we've historically seen successful integration in many ways. So when we look at HIV screening and treatment initiation, being very well integrated actually now into antenatal care, and in many countries also with sexual reproductive health services. But we still face quite a few challenges beyond antenatal care and delivery, even though we've seen some promising examples of integration into maternal and child health services, examples of joint services linking, serving, and monitoring both mother and baby pairs together. This, of course, has resulted in improved retention, early infant diagnosis, and improved health outcomes. However, with integration, like all things, context, preparation, and partnership is everything. And in theory, whilst well supported and needed, is much harder really to do in practice at the point of care. Whilst elements of integration are not new, and definitely in our smaller community healthcare centres where we have one or two nurses, integration has always been an operational necessity. However, when we look at our higher level healthcare centres, we have multiple entry points, different spaces, programs, different medical records, files, stationery, and often providers who generally are not equipped to cover the screening and management across a range of disease areas for all ages and diverse population groups. So I think in many ways we need to rethink our expectation, pragmatic in establishing priority elements, as well as setting a realistic pace for integration. I mean, given our recent funding shifts, we've seen many health providers, community health workers, and our community partners, as well as many services being removed. And once again, our response is to ask our frontline health providers to do more, to absorb an additional caseload, to expand their scope of services with less and often without any additional support. So without sufficient preparation, resourcing, training, we stand a real risk of compromising quality of care. And unfortunately, we will see more children falling between the cracks, breastfeeding, pregnant and breastfeeding women not being tested, with increased vertical transmission rates, and children being identified late, or advanced HIV disease not being identified, resulting in increased risk of morbidity and mortality. So whilst countries reprioritize packages of care and make difficult choices, this must not mean deprioritizing children. Integration must be, as already said, purposeful, planned, equitable, rights-based, It can't be a quick fix or cost-cutting exercise, but a longer-term effort to build and strengthen primary health care for children. I'm not sure if you want me to quickly talk about moving forward or...
Yes, please.
Okay, I've got time. Okay.
In a minute.
All right, a minute, okay. I think just importantly, the Global Alliance will need to consider how it supports countries really to review and prioritize their plans, how integration strategies and evidence-based integration models can be scaled and lessons can be shared across the region. I think country plans and priorities should be fully integrated into national plans, global fund replenishments and other conditional grants, and must not be relegated to political statements or declarations alone, but rather be woven into working plans and anchored in a robust framework of accountability and responsibility, and as a standing item on the agenda of national and subnational coordinating structures and technical working groups. And as PATA, we strongly urge our governments that as they refine and reprioritize packages of care and service integration, to really make sure that those who deliver the services, who know how best integration can work, who are best placed to troubleshoot, manage, and mitigate the challenges and the realities of operational delivery, they must be brought into all decision-making spaces as they have the know-how. For integration strategies to work and be sustainable, they need to be country-owned, locally led and supported. And most importantly, they need to support the meaningful engagement of those who deliver and receive the services. And very lastly, I want to talk a little bit about all of us in the room, because often many of us find ourselves in the same meetings, in the same structures, and just trying to think a little bit differently about integration and what that actually means for all of us as civil society, all working together with government. But really, I think a critical question is we need to also ask ourselves together to ask how we build, support, strengthen, and really get behind one solid global advocacy plan of action for children. Because we also need to be better aligned and consolidated. Surely more can get done if we organize ourselves better, we can integrate and utilize our own resources in a more strategic, focused way. Many of us sit in global alliance structures at global, regional, country level, in various pillar meetings. We support different advocacy efforts in different structures and coalitions. We share lessons through POLCA and various other learning research networks. How can we do this better to also integrate our efforts in building and supporting one strong, consolidated alliance and strong advocacy structure that can lead collective advocacy campaigns, messaging, and offer regional linking and learning in Africa, with a focus on BTP, children and young people in a more structured and coordinated way. Thank you.
Thank you so much, Luan. A clap for Luan. I think I take from you one critical thing, that we need to come together and develop one global advocacy plan for children. And I think at a time when global solidarity is shaky and everyone is wondering how to strengthen it, this can be a landing point for doing something like this, because you may not be too excited about children maybe, but everyone loves children, right? So we can all come together about things that matter to us. Thank you so much, Luan. And to you, Dr. Shafiq, they said to say to you in one sentence, and I think they did not plan for you to be here because that is an impossible task. What is the Global Alliance for today, and why must it continue to exist? If the Alliance disappeared tomorrow, what would break fast and who would feel it the most?
Thank you very much. A long question, but a long answer. But first of all, let me say that I'm very proud of the work that the Alliance has accomplished and the work that UNICEF together with UNAIDS and WHO has done to create this community of countries, of communities, of stakeholders that are allied, that are committed to seeing this goal of enabling children. I think that's a very powerful and resonant message for everybody, and it really matters today. So if your question is, what is the Alliance about? I would say we stand for what we stood for, which is an action-oriented coalition that puts governments and communities in the driving seat for change. But obviously the question is not so much what are we, but how do we evolve in the current environment? And clearly when the Alliance was launched in 22, the environment was very different. We knew even then, by the way, that funding was short. I mean, the glory days of spend as much as you like were long past us. But we also knew that there were donors and partners and US government in the room that really wanted to see the same vision that we had. And so there was a sense of confidence, buoyancy when we came together with this shared mission. Now, of course, today's reality is very different, and I want to highlight the UNICEF-UNAIDS Cost of Inaction report, which was launched just a few days ago, just prior to World AIDS Day. And the report is a modeling of spectrum data using spectrum tools like the GOALS model, and where we took different scenarios of what could happen in the future. And in one of those scenarios, we modeled out to 2040, and in one of those scenarios, we looked at what could happen if the coverage of PMTCT, of ART among pregnant women fell to 50% as opposed to 84% where it is today. Now, in that scenario, if you go out to 2040, you would see 3 million new HIV infections in children and 1.8 million child deaths. And that is just from that one change that happens in coverage. So it's pretty significant. But of course, it's a scenario prediction and not a prophecy. That future might not come to pass, but we have to act if we want to see that happen. If we don't act, the cost of inaction report tells us that this is the kind of situation that we might be dealing with. And I also want to give some voice to what we're hearing from the field. We are being told that drugs are running short. DSD systems are falling apart because no one is getting multi-month prescribing. Health workers are being and have been laid off, clinics have been shuttered, diagnostic services are faltering, and especially community support structures have been decimated. So in this environment, I think the Alliance is more important than ever. And if it disappeared today, I think what would break is our momentum, our community forum, our unified voice for advocacy in an environment that is increasingly challenging and competitive. And I see 2 key pivot points for what we need to be doing in the future. One of them is integration, and I take Luann's warning to us very much to heart, saying don't just throw this word around as if it doesn't mean anything, because it means something very important to the frontline workers that have to do the integration. So I take this an advisement, but I think we have to champion and figure out local, contextually relevant community and provider-led models for integration. And we know this works. We've managed to reach over 80% coverage of ART in pregnant women by integrating HIV testing and counseling into ANC. And I would venture that there isn't an ANC clinic in Africa today that doesn't offer testing and treatment to pregnant women. And tomorrow, hopefully, that testing and treatment will extend to syphilis and hepatitis B. So there's integration on top of integration that we've been able to accomplish in the ANC space. And we also have exceptional models for how integration could work in the service delivery space. Malawi has pioneered IC3, integrated chronic care clinics. And these are clinics that take the model of HIV, the way we do things in HIV spaces, with communities, with consent, with confidentiality, and they have expanded that model to be able to provide services for adults as well as children for all chronic conditions, not just HIV, but hypertension, diabetes, and other chronic illnesses that are encountered in the health service. And from Zimbabwe, we've seen the model of Randiri's community service integration, where peer supporters who are in the community supporting adolescents are now providing support way beyond HIV, and are also counseling and supporting adolescents with their other health and sexual and reproductive health needs. So there are exciting models for how this could work, and I think for us in the Alliance, we need to take stock of this. This doesn't require a huge amount of resources to try to survey and scan the landscape. I know that that's work that's already ongoing with PATA and with other partners in the room, and really understand what integration could look like and pivot our technical support towards models that can try to support that work. And the other two key pivot points are visibility and expansion. In fact, far from disappearing, I think we should expand and get louder. We need more countries and we need more partners, and actually we need African partners who join the Alliance so that we bring African expertise, African academic institutions into the Alliance's work. You know, one of the things that is abundantly clear is the need for a kind of a reclaiming of African health sovereignty, which perhaps we have given up in the HIV space because of the the deep-pocketed and insistent donors that were supporting and funding so much of the early expansion. It's been critical work. There are millions that wouldn't be alive today without that work having been done, without the support of global institutions and global donors. But I think it's time to take some of that back to African institutions and put governments and communities in charge in a different way. So, by the way, I'm just also really pleased to announce that in the spirit of better collaboration, the Global Alliance, with support from IAS, will be funding 2 countries from Mozambique and Nigeria to visit a champion country, perhaps Namibia, we haven't quite decided yet, but a country where they can really learn from the experience of having eliminated HIV transmission from mother to child. So we're very pleased to announce that will be happening in 2026. And thank you to IAS for the support for that endeavor. We'll be sharing more details with you later.
Thank you so much. Another clap for IAS. I think this planning is what will be needed to move us forward, and thank you for eloquently sharing examples from different countries, Dr. Shafiq. I started as a pseudo-Dutch. I'm ending as a Kenyan. So give me a few more minutes of your time. But I feel like Dr. Macharia is here from ECPAM, and it would be nice to just having listened to Luan and really taking in the realities of the healthcare providers, the implementing partners that have to take on the integration and what that really looks like. What do you think the Alliance should change to better support implementers going forward? Just carrying on from what Luan also shared.
Well, thank you so much, and thank you, panelists, for such an amazing session. And I mean, it's a very reflective time. I think you've all sort of said it. I mean, we're at a pivotal time. We've been hearing that quite a lot. Dr. Kaseba and Dr. Shafiq and I were just from a session with the First Ladies, and really trying to see how, just the realization of how much the political sort of goodwill that they have, that we could also benefit as a global alliance. So I think that's the first point. Change is here, there's nothing much we can do about change, but we just sort of need to move forward. There are various models we have, we've been discussing, and you've all talked about integration. I know even from EGPA's side,
It's something that we're looking at and being very careful because it's not the silver bullet or slash magic bullet, especially for kids, because kids get lost in the system. And we've seen this even in the last few months when, with all best intentions, even when programs started coming back slowly, kids were always going to be left behind and were already left behind even before all these challenges that we have. So it's also to think, how do we leverage various platforms, whether it's First Ladies, I know the MC and the chair of the session, we are also together in the Vatican in the Rome Action Plan. Looking at that as well, our child champion was also going to be part of how we also advocate better for children. So I think that's the thing, is thinking about how do we make sure we're not losing children in the system, making sure that we can also track mother-baby pairs. That's going to be extremely critical. During this session that we had, interesting enough, there was an interesting question that was asked about education and kids. And we all here who advocate so strongly for children know the role of early childhood development and child survival. So I do think, even as an alliance, we've had so much success as achievements, but it's really to think about what do these sort of next partnerships bring and what do they look like? Who else do we need to reach out to? But most important, how do we make sure that with all these new models and approaches and pivoting, the child is not left behind? Because it's very easy to look for the next tranche of funding, but the children are still being left behind. We have to remember why they were being left behind earlier on. We know what those were, the testing and treating and virus suppression. Those are still there, but now there are other new challenges. And how do we leverage the alliance and other partners that are here, including ourselves as ends of the Place of Pediatric Needs Foundation? We are really honored to continue being a collaborator, and we look forward to engaging and looking for solutions that drive us forward. Thank you.
Thank you so much, Dr. Machari, and I think you said it all. We need to keep doing what we need to do, and I want to say what you said, but from something I heard earlier this week. We need to integrate not only systems, but partnerships and friendships as well. Colleagues, it's been an interesting discussion, but I would like to just have Dr. Kasiva, who's been listening attentively, maybe close us off with some closing remarks. Over to you, Dr. Kasiva.
Thank you very much. I thought it was an excellent, inspiring session. And for me, it's an honor to be here in this amazing audience. And I feel this spirit of collaboration.
Just did it.
And looking forward to future.
So it was long. The crown
new
of a
opportunities
back.
that we can bring
I mean, like
to
a check
children.
account.
And it's great to be part of this alliance, global alliance, and I believe in partnerships because especially nowadays when we are facing a lot of challenges in the world, there is no chance to survive. We have to build strong partnerships, but on the clear principles of transparency and accountability and clear mandate. Who is doing what for what and what impact is expected. We should be truly impact oriented, and I like this main principle: country focus and impact orientation of global alliance. For me, the most important messages, of course, came from Bahati, and we have to listen to them very carefully because they are guiding us and giving us indication how the principles that we are trying to promote in reality. And while I believe in integration, the word integration itself has been compromised already by numerous interpretations. And exactly what Luan is sharing, when one person is in charge of 5 to 10 topics, it's not an integration. We are keeping overwhelming this poor person, and we are not reaching the result we're expecting. The quality will be suffering. And that's why we have to clarify this is first task for all of us to have unanimous shared opinion. What is integration? So, not for the purposes of integration of any activities that are reasonable based on the current situation in the country that improve access to care, they could be considered as a reasonable integration. Otherwise, it's just words advocacy, and we will go nowhere with this. But integration could become a real driver today, especially with a lot of limitations, no other ways. Of
Of course, community is at the center, absolutely must. Maybe to teach. We are promoting, we are advocating all the time, but maybe now it's the time to fix somehow in the laws, in the regulatory documents of the countries, to stop this constant struggle